Have you ever seen athletes walking around and they've got all sorts of tape that looks kind of like this? Maybe it's black, maybe it's blue, maybe it's green, maybe it's red. There's a bunch of different colors, but it's just taped all over them. And you think to yourself, did they just tape up an injury? Well, Dr. Sam, that's a good question for you. Do you just tape up injuries?
Well, not really, Hunter. When it comes to like use of this tape, which is called kinesiotape or K-tape for short, what you want to do is you want to make sure that how you use it and tension you put on it has different purposes. So by just, let's say you have a bruise in this area right here, and you want to help the bruising to heal faster. What you would do is put it lightly on, put about 20% tension on the tape, and you put it lightly on, it lifts the skin up and drains the bruise faster. So in the segments before, we've done some Graston work on you where we release the soft tissue in the area, which giving you full range of motion. However, if we want to hold on to it until our next visit together, and we can use the tape to help us out with that. So what I'm going to do here is I'm going to tape you up, and again, we've done a full assessment. So what I'm going to do is I'm going to actually open it up like this. Now this is the placement. So you're going to put your hand, and you're actually going to extend it down like this. This is where a professional can tell you how the tape can be done perfectly. So we're extending it out like that. What I'm going to do is I'm going to actually put the tensile force on there about 50 to 75%. As I do, the ends don't get any tension because those are the anchors, and then just like that. Basically, we've already done an assessment. We know exactly where Hunter's tension was coming from. So I'm pulling on this area, pulling it back up. These are the anchors, and he holds on to that area. You're able to now work out and do everything normally would. This is just gonna help stabilize it in the right position.
And if you were watching recently, Dr. Sam did some soft tissue work on my elbow to show you an example of how it's not just the adjustments, it's also your muscles that need to hold those adjustments in the right place. And now that I have this tape, that is then releasing the tension, or no, it's creating tension, but in the right place.
Exactly. It can release and or create tension as you need it. That's why it's done by a professional. That's why a lot of times when I have patients come into my office and say, hey, I've seen this at CVS or Walgreens and I have the tape, and they apply it on themselves. If done incorrectly, you can make your injury worse. So it's always good to do it with a professional. Even if you purchase the tape and bring it to a chiropractor or physical therapy office, talk to the professional and see how's the best way to tape it to get the most bang for your buck.
How long do I leave this here?
That's a good question. It can be up to, depending on how you're working with a professional, they may want you to keep it on for a day or two. You can shower with this. This is the biggest thing. You can shower with this, you can swim with this, give you some nice tan lines around it if you take it to the beach. But the other thing is, you may want to keep it on. I always tell my patients no longer than 3 days. If it's been 3 days, it'll start fraying. That's why you notice that I cut it with circular on the edges so it stays on a little better, it doesn't fray at the end. But after 3 days, I tell a patient, go ahead and take it off, because this isn't a crutch. This is just this is made to help us. So the inevitable goal is to get that functionality back the right way.
Well, you know, I'm feeling more athletic already, so thank you so much.
No problem, absolutely.